Good morning, everyone. I am Dr. Vijeta, and today we are going to discuss unexplained infertility. I have taken the content from Evidence Based Treatment for Couples with Unexplained Infertility, ASRM 2020 article, and Sparrow. Let's first define the incidence of unexplained infertility. Incidence of unexplained infertility. As we have discussed in the evaluation of female infertility, that in couple infertility, unexplained infertility contribute to 10%. In the ASRM article 2020, it was found that up to 30% are diagnosed with unexplained infertility. So why there is so much huge variation that during the evaluation of female infertility, it is shown that 10% is the unexplained infertility, and in ASRM article, it was shown that up to 30% are unexplained infertility. This variation is because of the diagnostic criteria being used to diagnose unexplained infertility. Let's discuss what are the diagnostic criteria which are used to diagnose unexplained infertility. So, unexplained infertility is basically diagnosis of exclusion. And if the systemic evaluation fails to identify any cause of infertility, then we will define it as unexplained. So, what all tests we will require to call as unexplained infertility? The first one is at least one fallopian tube should be patent. Second is the documentation of ovulation, and the third is normal semen analysis, which means adequate number of motile sperm for the male partner. If these three are normal, then the patient is identified as unexplained infertility. Let's discuss a gray zone, that is whether we have to evaluate the uterine cavity before calling it unexplained infertility. This was taken from Speroff, and in that the unexplained infertility implies that a patient means couple has normal semen analysis, ovulatory function is normal, and the uterine cavity should be normal, and at least one tube should be patent. So they have also included the normal uterine cavity in unexplained infertility definition. Let What all tests are not required for diagnosis of unexplained infertility? These are the postcoital test for ruling out cervical factor, the endometrial biopsy for luteal phase defect, and the diagnostic laparoscopy for adhesion or mild endometriosis. As a result of these, the infertility contributed by the cervical factor, luteal phase defect, and mild endometriosis are now classified as unexplained infertility, and unexplained infertility compromises a very heterogeneous group and also include mild male factor infertility. So the management aim is not correcting the disorder as we do not know the disorder. So the main focus is on achieving pregnancy, and the no treatable causes identified. Therefore, the treatment is necessity empirical. Why? Why is there? Some people have unexplained infertility. So the explanation is two potential explanation is given for that. First is there is no abnormality, but the couple natural fertility is at a lower end of the normal range. That's why they are not conceiving. The another explanation is we do not have any diagnostic test to identify that specific cause. For example, if the gamete is abnormal, oocyte there is some abnormality, we do not have any test to identify this. So So this may be the reason of unexplained infertility. So these are the two potential explanations for that. Let's define the prognosis of the unexplained infertility. So in younger patient, the unexplained infertility prognosis is good because there is subtle defect in ovulation and or subtle defect in the tubal function or some male factor abnormality which can be dealt with the IVF procedures. But in older patients, the benefit is less likely because we cannot improve the quality of the oocyte and the number of oocytes are also low. After the prognosis, let's discuss the treatment of unexplained infertility. So the treatment is, the gold standard is ovarian stimulation with oral medication with intrauterine insemination. If this fails, then in vitro fertilization. So how we are able to achieve a successful pregnancy in unexplained infertility with ovarian stimulation and IUI? The basic how it works is that ovarian stimulation will increase the number of oocytes and IUI will increase the number of motile sperm in the uterus. That's how it increases the fecundability. So if the oocyte will number of oocyte will be increased for fertilization and also the number of motile sperm in the uterus. This is about today lecture, and in the next lecture we'll discuss the various treatment modalities and the level of recommendation for that. I hope you enjoyed the lecture. Thank you.